this way personally for a short one. This is a short one, guys, okay? Fold it up and just roll it tight, okay? I've seen people like to put garbage bags in them. Have you seen that? To make really stiff towels, which is a waste of time, you guys. So if you have a nice one, you know, a nice fat one, it will stay on there. Now, if you have like a major tray or a bunch of trays, you can always do two to make it stiff too. Just come on in there, roll it tight. This would be a really big instrument tray. This is a small back table too, you guys. Okay, if I have a big case, I'm gonna have a big table that's gonna go out to here, so I have more than enough room to stack my, you know, stuff on. Like so.
And you can, we're telling you like her way versus my way versus Miss Luckett's way, just to show you different ways that different techs do it. Another thing, you can spread it out like this, or you can be more compact, because you don't know when you might need an end of the table for something, that you may be retracting or doing something. The assistant may want to use that table for specimens or different things. You can make it more compact and put your tray right here, because you'll see a lot of techs do that too. Put your tray here and put your instruments in front. Make this stuff compact, and then you have more space to use. If you need to add a tray during the procedure, let's say it went from a laparoscopic to an open case, then you've got room without having to rearrange your entire table.
Yeah. So it's your, and left-handed people, they always seem to be on the left side too, or their tips face the opposite direction. Have you noticed that? A lot of left-handed, you'll find their tips going this direction. So we all have our own little things, and you guys are going to find your own.
So see, that's how we're saying you may work with 20 techs, and you may be shown 20 different ways to do one thing. And eventually, but when you're with that tech that day, you do it the way they want you to do it. If they're controlling and want you to do it their way, then do it their way, and eventually you'll pick your own ways up.
And please do not say to them, well, Susie didn't do it that way.
Right.
You're not going to make friends, you guys. Just zip it and be happy that you got someone to
just
teach
say,
it.
okay, and remember, you're learning something new, you're learning something different. Just because even if you like the way so-and-so did it, that doesn't mean that you may not learn something from this other so-and-so.
And the other thing you need to remember is you don't need everything on your mayo.
No.
Use as few things as you can get by with, and if you're using a small tray, you know where everything is on your back table. All you have to do is reach back and get it if you need it. If you put a lot of crap on your mayo, you're stirring it around and you can't find anything.
Which is why organization on your back table is mandatory. Like, I went in one day and there was a student, and her back table, oh my God, I like to have had a stroke. There was like trash everywhere and stuff everywhere, and I asked the tech, she was working with the doctor, and I said, can I work with my student? She said, please, because I'm about to have a stroke with her back table. And so I just kind of stood back there, and I was like, okay, this is trash, this needs to go away, and I helped her organize it, and I was like, this is a clean back table, because if it's not organized, and you have an emergency, you have a bleeder, you have something happen, then you're not going to be able, you want someone else to be able to go behind you and work off your back table if need be, because you never know what's going to happen.
And you have lunch relief, so someone needs to come in and be able to look at your mayo, look at your back table, and know where things are. They may not rearrange anything, but after you work there a while, you know what the trays are, and it's pretty simplistic.
See, another thing is sometimes you're going to have so many instruments on a clamp or on a stringer, you might have to do a double row too. Another thing to keep in mind, this is a minor tray, right? If I'm doing a hysterectomy or something like that, I might need gynecological instruments too. Try to keep them separate, because if we're counting together, I mean, we're going to be chasing things if I'm mixing and matching trays.
Always keep your trays together.
So if I had a second stringer, that would be like my one stringer, this would be my other stringer. So when I'm counting, here's my GYN tray, here's my major tray in the front, or whichever way you choose to do it.
Or you can keep them separated on one long towel.
Exactly.
If you have a lot of other things, use the same towel, but have them separated.
And you have a limited amount of time to do your counts.
Yes.
By the time the peritoneum is closed, you want your instruments and everything counted, and then you do a second count when you get to scan.
This, by the way, you guys, I didn't do it, but it does have sticky on the back to see what happened here when I did that. So just pull the sticky off, stick it down, which I'm not going to do.
Will you, well, we don't have a lot of needles to show.
I got one.
Sometimes you may have Usually when you do needles, and you guys can tell me y'all's opinion, usually when you do needles, like let's say you have 32 needles, you're gonna wanna group them in twos.
Mm-hmm.
Like put 2 needles together, 2 needles together.
Which another thing I'm gonna do, and I'm gonna do it right now. If you have long pieces that you know the doctor's gonna use over, as far as the suture goes, leave it long, make sure your sutures are not dangling off your table. If you know it's not gonna be used again, another thing, cut it short. Did you give me another one?
I did, I was
Oh,
about to
okay.
tell you because we need to count.
Cut
But-
it short,
Yeah.
see that? And there is, ooh, she gave me a bunch of them, all right. So I'm gonna show her right away, we're gonna go 1, 2, 3, 4, 5, okay? Now, let's say I'm up to my full limit of my needle box. I can go back this way by twos. And usually you wanna put 2 of the same needle together, because see, I have a little SH here, and then I have a big one here, so it kinda throws off from it. But you can go twos, but how are we counting them?
One by
One
one.
at a
Yes.
time. But
No.
it's just easier if you look down your tray
Yep.
You can go
and you
1,
see
2,
that
3,
you
4.
have, usually in the magnetic, you're gonna do it in groups of twos.
Yep, over here.
But over here, in the foam, you're gonna wanna do 1 to a number
this.
until you fill it up.
Okay, and then go back.
Yeah,
And-
and then go back.
Needle boxes are cheap, you guys, when you think about it. If you fill a needle box, I mean, there's some cases you're gonna go through a lot of needles. If you fill a needle box, ask for a second one. There's no reason why not to. So what she's saying is, okay, I'd have 2 here. This one's not cooperating, the chromic.
Yeah.
2 there, 2 there, so I could see them, but I'm gonna make sure that they're all separate, okay?
Do you need that? Or is it
Yep.
supposed to be like that?
Yep.
And then, one last thing, you don't want, like she said, you don't want your suture hanging over the table.
No.
But try not to cut your suture off until the end, until you absolutely know that, because as soon as you cut it, I guarantee that's when your surgeon's gonna say, hey, don't we have a little piece of that chromic left? And you're, then you have to waste and open another
Yeah.
suture.
Now, if you got this much on the needle, it's
you
not
have
worth,
it,
but
you
you know
know.
what she's talking about, okay? In the end, when everything goes in the garbage sharps, put your blades in here too, you guys, okay? Because when you're done, you're just gonna close your box. Nice and clean, no one's gonna get hurt right in the bio box,
And
okay?
as a rule, don't stick your fingers in your sharp spots.
No, please don't.
When you go to pick something up, if your knife blade's in there, you know that's the skin knife blade, you've laid it over there, the doctor wants to extend the incision. Use your needle holder, go in there and get your knife blade out.
Yeah.
Or even though there's one needle, make it a habit to use your needle holder to get things out of your sharps, because the other end that the suture was cut off of could be just as sharp. If it's in there 99.999% of the time, it's already been used on the patient somehow, and you don't want to get stuck. And count with the forceps, count with a knife handle or a needle holder.
A
Definitely.
lot of times, after you use your skin knife, I usually just lay it on the back table and leave it alone. If you have to extend the skin incision, you can reach back and continue to use that same knife handle and blade. But I take it off the Mayo because it's one less sharp thing that you can get cut on.
And you don't want to hand him, when he says knife, you don't want to accidentally hand him
The
the
raw.
skin blade when you're inside the body,
No.
because it's considered dirty.
Which
Yes.
side of this Mayo are you guys standing on? Think
sorry?
about it. I'm asking.
Right here?
Are you standing here or here on this
Oh.
Mayo stand? When you're bringing it up to the table?
Oh, I'm thinking.
Why? Okay, all right, I'm gonna tell you right now. I'm gonna stand, and I'm sure you guys do too, on this side, and why is that? I can control my Mayo stand, okay? And when they were talking about sharps, it brought something to mind for me. My sharps are always the furthest away from me, okay? Because my hands are right here, okay? So if they're the furthest away from me, my hands should be pretty safe, protected, aren't they? You guys the same way? Yeah.
When you're moving the Mayo stand?
Mm-hmm.
You can touch the whole
Can
thing.
you?
There's a
Yeah, I
lot
know
of
we said this
confusion
was
with-
sterile, but I,
It is sterile, and you can touch it, because you're gonna have to touch it to lift it up and down.
Yeah.
Yeah.
And to slide it.
So you can
I just wanted to clarify
Yeah,
that.
because
Yeah.
when this goes over the patients.
You got a lot of problems.
Yeah, I don't want to talk about this.
And you're gonna find yourself.
Yes,
a lot
I
of
was gonna
times-
ask about the needles. Do we
Yes.
have to take them out of the packages before we, or can we leave them in there and just pull them out as they
You
need?
can
We
do
can
that.
put like this whole 5-pack on
Yes,
after counted, open it and put it on our mail stand and then
Yes.
just
Yes.
grab them
Yes.
as they need them.
yes.
Instead of
That's a
actually
better
take,
technique,
yeah.
actually.
That's what you want.
Cause I don't think I'd wanna put them in
It's
there,
not
cause that
really
seems
good.
harder
I would
to
take this
grab.
whole thing with me, and
Yeah.
I'm gonna say.
And just
you
put 'em there when I'm
actually
done with
can-
them.
hope I'm not getting in trouble here. I've seen needle boxes up here too. Like if you're doing a hysterectomy, they're popping sutures as fast as they can go. You know, instead of this back and forth, put yourself a little like half your pad or something up there. You know, your needles. But no, I wouldn't leave. If I know I'm using them are coming up.
Yeah, that's what I was like, cause you were saying you could like grab stuff out from this side, and I was like, I wouldn't want to, cause it just seems like it'd be really hard. I find it very hard to grab knife blades with the.
That is, you're right.
Like,
It's
don't
I
all-
would
overdo
just
what
put it
she-
there when I'm done
See,
with it.
it's really, I
See
mean,
how she
I
can't
have,
get it?
I
Yeah,
have
exactly.
fingernails even, and I can't get the
Yeah,
blessed
that's why I was
thing
like,
out. Where your needle holder's your best friend, you guys.
yeah.
It
Okay?
really is.
Honey, show them how to put the,
Light handles.
light handles on.
Oh, okay.
That's what
Light
I
was
handles,
wondering what that
condoms?
is.
Is that what you just
Oh,
said?
that's
Consider
what
it
that.
fit.
Both, I just wanted them to see how it worked.
I was wondering what that was.
And see, then you can move the light anywhere
then we
you want.
Show them for short people.
Full
Yes,
control?
please.
Show them for the short.
Well, you're gonna have to come
Okay.
for that, because I've never experienced that.
You just jump?
Okay, let's say, you can grab it,
Yes,
like
you
with
got
this, like you can grab it and pull it
Yeah.
down, get the light handle on, and then push it out of the way, because granted, it works for me, but you know, if your surgeon's tall and he hits his head, you've had a really bad day. But you can grab it with this, pull it down, get it on, because sometimes it's hard to reach.
But if it's too high, can we have our circulator bring
Yes,
it down and
yes.
then we?
Yes.
And sometimes, there have been times that I've just told the surgeon, I was like, the light handles are yours. But I didn't do that when I was new.
Yeah.
But sometimes, I'm sorry, sometimes they're so tall that, and the circulator's busy doing something, you couldn't get to it, you'll just tell the surgeon, I couldn't get the light handles. And, you know, they're fine, and most of the time, they'll see them up there, and they'll grab them. They'll grab them and do them, and you don't have to say anything.
All right, when your suction comes, when it's open, it's like so, right? Go ahead, put your suction together, you guys. Try to get all the steps done that you can get done before that surgery starts.
And that suction tip goes on your count sheet also.
Yes.
So
And-
yonker.
Yeah.
Yankee.
Yonker, I like to show it that.
Yankee.
What else are we missing? That's it?
Yep.
Yeah, I'd ask for my saline, and of course, what am I gonna do with that saline when she gives it to me?
Gotta check it.
Yep, but I'm gonna label and date it, okay, cause if she gave me saline and then she gave me Marcaine, a little bit of local, they're both clear, right?
Right.
You know, so.
How would you label?
You're
You'd
gonna,
label
you're
it
gonna get a
on.
marker, and we don't have any, you're gonna
No,
get a
okay.
sterile marker that comes with your
Yeah.
packs, and it's gonna have little labels.
Okay,
You're
that's.
going, and sometimes your techs or nurses will go ahead and say, you know what, I'm gonna give you this and this and this, and they'll say, go ahead and make out your labels, and then after you see it, and they pour it, then you can label it, or you can go ahead and label it when they see it, and you can tell them where you want it, or they'll see where to pour it. Stop.
She just had a major hiccup behind me.
In the book, it was talking about a neutral zone.
Sharp zone.
That's, yeah.
That's your
that's-
Okay, so,
that's
yeah, so,
sharps.
okay, because I was
Yes.
Sharp
thinking it
zone.
was on the main, okay.
There again, you can have some places do where there's a pan that you have to pass all your sharps in. Some consider that a neutral zone, some could follow the hospital policy on it, okay?
You have to label everything on your
Yes.
back table, medicines, salines, things like that, because if Jaco, or if anyone walks in and you're caught and your medicines or anything are not labeled, major,
Fine.
major fines.
That's a fine, but the
Exactly.
other bigger issue is the wrong thing is
Absolutely.
injected.
Yeah,
Absolutely.
you know, like if I inject dye into some place that shouldn't be, and do not label your bowls, they don't stay, they're plastic. You know, if I take a little marker and write on this bowl and then pick this bowl up, how long do you think that's gonna last you guys? Not, so in your little skin pads, you will find little sticky tapes. and just write on them and stick them on the bowl.
You just
And
stick it on the
you-
side there, or
Wherever
you,
go-
I'm a lip usually.
Wherever
Yeah,
they
so it's
want
just
it to
sticking
be,
off to
wherever
the
your
side.
tech wants you to have it.
Okay.
Yeah. I'm the type, and I'm sure you two are too, I will not go in a room and relieve somebody if nothing